If you're headed to the hospital or just getting home after a hospital stay, you're probably on information overload. Prescriptions, medical forms, diet restrictions, and more can all make the process as confusing as it is physically challenging. As you wade through all this information, from admissions through discharge, it's important that you seek the best care. The last thing you want is another health problem or setback on your road to recovery. This is why it's so important to know that being in the hospital increases your risk for the development of a life-threatening blood clot, particularly if you're dealing with surgery, a physical trauma, prolonged immobility, or a serious illness like cancer. In fact, about half of all blood clots occur during a hospital stay or within 3 months of a hospital stay or surgery. Get the facts. Blood clots occur most often in the legs. A blood clot in your legs can travel to your lungs, which can be deadly. 900,000 people in the United States are affected by blood clots each year. About 100,000 of these people will die, which is greater than the number of deaths due to AIDS, breast cancer, and motor vehicle crashes combined. While many blood clots that occur with surgery or during or after a hospital stay can be prevented, about half of hospital patients don't receive the proper prevention measures. Blood clots most commonly occur in the legs, arms, lungs, or abdomen. Roughly 1 in 10 hospital deaths are due to blood clots in the lungs. Don't let that one person be you. Work with your doctor and make sure you have a plan to prevent blood clots. Before you enter the hospital, talk to your doctor about your blood clot risks and ask if you'll need prevention measures while in the hospital. Hospitalization for illness, physical trauma, or surgery, particularly surgery of the pelvis, abdomen, hip, or knee, is one of the leading risk factors for blood clots. Other factors that can increase the risk for blood clots include pregnancy, cancer and some types of cancer treatment, birth control methods that contain estrogen, including the pill, patch, and ring, hormone therapy with estrogen, a personal or family history of blood clots, being overweight and active or sitting too long, age 55 or older, and certain long-term diseases such as heart or lung conditions or diabetes. Before you leave the hospital, ask your doctor what you can do at home to prevent blood clots. Discuss the signs and symptoms of blood clots, and be sure you know what to do if you experience any of the warning signs. The signs or symptoms of a blood clot in your legs or arms can include swelling, pain or tenderness not caused by an injury, and the skin may be warm to the touch and red or discolored. If you experience any of these symptoms, talk to your doctor or healthcare provider as soon as you can. The signs or symptoms of a blood clot in your lung could include difficulty breathing, chest pain that worsens with a deep breath, coughing up blood, and a faster than normal or irregular heartbeat. Seek immediate medical attention if you experience any of these signs or symptoms. When you get home, follow all instructions you're given and take your medications as prescribed. If you can, get up and move around as often as possible. If you're confined to a bed or wheelchair, move your arms and legs as often as you can, or ask a family member or friend to help you if you're having trouble doing so on your own. Notify your doctor if you experience signs or symptoms of blood clots. If you or someone you know is going to the hospital, have a prevention plan. Get better. Don't get a blood clot. Share this video with friends and family so they too get the information they need to know about life-threatening blood clots. Stop the clot, spread the word, and maybe even save a life.